welcome everyone. Good day, nurses, and welcome to the Empowering the Nursing Voice Advocacy Highlights from ONS Congress 2024, presented to you by ONS California. My name is Wendy Nuval-Becerra. I'm a member of ONS California. I'm an oncology nurse, and I'm the current president of the ONS Orange County chapter. So first things first, what is ONS California? So ONS California is a state-based advocacy organization of oncology nurses. So in the fall of 2022, the Oncology Nursing Society actually held its annual Capitol Days in Washington, D.C., where oncology nurses from all over the 50 states came together to learn about the importance of advocacy and how we tell our stories to elected officials, and therefore encourage them to support legislation that we believe is important to oncology nurses and to cancer care. So ONS grouped the nurses by their states to encourage them to form networks and bring back what they learned to their respective chapters. And I'm so proud and honored to have been part of that California group of nurses who accepted that challenge. While we were in DC, we all promised we'd get together when we got home and do something locally. And with the inspiration and organizational skills of Ms. Jelani DeCastro, and with the advice of ONS's past government relations liaison, Alex Stone, the California Advocacy Group was born. We started meeting over Zoom and planning our first Advocacy Day in Sacramento. So today, you will hear from many of our founding members about how they built and continue to build a robust network of advocacy-trained nurses and how they have organized an annual advocacy summit, which is a nonpartisan advocacy event where oncology nurses throughout the state of California spend one day learning about bills important to oncology and learning advocacy skills. And then we spend the next day actually using these skills to lobby elected officials to support the bills, to form relationships with them so that they use us oncology nurses as resources for information and advice on cancer care in the future. So first, it's my pleasure to introduce Jelani DeCastro, a nurse leader at City of Hope, the legislative director for the American Nurses Association, California, and the American Organization for Nursing Leadership's social media ambassador. Along with these many hats, Jelani is also the de facto leader of our ONS California group and will be providing an overview of ONS California's presentation at Congress this past April 2024. So with that, take it away, Jelani.
Thank you so much, Wendy. That was a wonderful introduction as to what we're doing as a group and our mission as California oncology nurses. So thank you so much for that generous introduction. Tonight, I'm going to be presenting what I presented at ONS Congress this year. I do admit it's not going to be as robust because I'm only presenting half. My co-presenter, I want to call her out here. It's going to show her photo on the next slide. But Ms. Carly Von Heater, she was the second half, and I would say like the soul of this presentation because she is a patient cancer survivor who presented on how she moved advocacy and legislation in her home state. So I'll talk a little bit about her, but this is the name of the presentation, Powerful Outcomes from Nurse and Patient Policy Advocacy. Next slide, please. I have no disclosures. Next slide, please. And these are the session objectives to inspire and instill hope. Inspire and instill hope with the power of advocacy, answer why nurses need to become involved in advocacy, and explain how nurses can become involved in advocacy. Next slide, please. So my advocacy journey. It starts in the pandemic. From what I'm formally doing now. But when I look back, actually in 2018, I became nursing supervisor at City of Hope. And I wanted to go into administration and nursing leadership because I wanted to lead nurses. And I really felt at that point in my career that nurses should be leading nurses. And so it was a difficult road for me because I'd never been in a formal leadership role, but I really loved what I was doing. I was leading nurses and knowing their journey and challenges and professional development goals. I wanted to be their biggest cheerleader, and I tried my best to step into that role. But in March of 2020, as you may recall, something happened, and it affected not just us in this country, but of course the entire world. So the where I stand now as legislative director, as a nurse in this California Advocacy Summit, and all the other projects I'm doing with nursing advocacy, it really is a journey that I never would have anticipated, or I never saw this on my bingo card of life. Um, but I always start with a pandemic. Like many, I was driven by feelings of loss and anger, especially in nursing leadership, where I didn't know how to support my nursing staff, and much less our patients, much less my family. Like, how was I going to support them when nobody had the answers? I really saw healthcare hit rock bottom, and I felt the nursing profession was abandoned. I really felt deeply disappointed in our profession. We were so unprepared. We have so many master's prepared, doctorate prepared, PhD prepared, multi-certified nurses in this country. And that was the place we found ourselves, where we couldn't even have the PPE we needed for our staff. We were, gosh, all the horrible stories. And even though 4.5 years have passed, 4 years have passed, I still get very angry thinking about those times, because we should not have been in that position, and yet we were the ones as a profession that could have prevented that from happening. And so I always talk about this as my Wizard of Oz moment. And I always had a feeling that someone would have our back as a profession, whether it was the government, the CEO of the hospital, the FDA, somebody, so the CDC. But it was truly my Wizard of Oz moment, where, and I joked about this in Congress, but if you've never watched The Wizard of Oz, I apologize. I'm going to spoil the movie for you. But there is a part where Dorothy peels back the curtain, and she thought that she would see a great and powerful wizard, and there was just a regular guy there. And so, that was my realization that, there is no one to save nurses other than ourselves. And instead of giving up, and I know many of my colleagues, many people I knew were leaving the profession or just checking out altogether, I really wanted to find answers, like answers to why we reached that low point in healthcare, and why as a profession we were so unprepared. The second photo on this slide is a screen grab from an ONS presentation that was given in about May 2020. And I wasn't into politics, I wasn't into advocacy. I was definitely a nurse that thought, oh, those two things don't mix. But as you know, when the world was on lockdown, everything was virtual, and everybody was just signing up for anything that they can, stream on their screens. And my I guess what I resorted to was signing up for just many nursing webinars, whatever was free, whatever I could come across. I signed up for those webinars, and this one in particular didn't really interest me at first, but I thought, well, okay, it's ONS. I respect Alex Stone, who was the legislative director, and it sounded like an interesting presentation. And I was multitasking, I remember, while it was on. And the speaker was Donna Shalala, who's a former Florida US representative. And she made a remark, and it was really just kind of off the cuff. It wasn't even, the part of the subject she was talking about. But at the time, she said, there's 6.5 million nurses in this country. Imagine if they all got together and decided to do something as a whole, what impact on healthcare that would have. And I stopped what I was doing, and I listened more intently on what she was saying, because I didn't realize that there were that many nurses in the country. And if there was that many nurses in the country, why were we in this position where we are now, where we couldn't even, get like masks or PPE, or, like policies kept changing in the hospital daily, if not hour by hour. So, I started listening more intently, and she was a great supporter of nurses, and a believer in the power of nursing. But no one yet has leveraged the power that we have in our numbers. So that really got me to thinking and investigating more. And, as the year progressed, vaccines came out, the world started opening up more. And my background as a oncology nurse and infusion nurse, I've been receiving the ONS emails for years and years. And I kept seeing this Capitol Hill Days pop up in my email. And so I wanted to check it out, and I signed up for that and was fortunate enough to be admitted. And that really that's really where my advocacy journey blossomed even more because prior to that, from May until like August, I was asking anybody I knew, if they knew how nurses could get involved in politics or advocacy or anything like that. And for the most part, everybody was looking at me like I was crazy. But when I walked into that Capitol Hill Day meeting in September and started talking to the nurses and meeting nurses from all over the country, then I realized, okay, I'm not crazy. I was just talking in the wrong circles. Like these are the people that understand the importance of advocacy and why nurses need to get involved. And that's where I met many of the presenters that are here tonight. I met them at that Capitol Hill Day, and we've had a great friendship since then. So next slide, please. So you know that saying, and you may have used it yourself, I'd like to speak with your manager. So this is a way in which I approach the second part of this journey of, okay, who do I talk to get the answers I need and to get what I want for the nursing profession? So if you want to talk to the manager, if you want to talk to the person that is, in charge of making decisions, you go to the highest level. And in this case, I was finding that the highest level is really our government, the politicians who write laws and regulate a lot of the healthcare industry in this country. So in the second slide here, you'll see a dream realized. So from September 2022 to May 2023, a group of nurses from all over California really just got together and did this grassroots effort. Many of them had been to Capitol Hill Days previously or, always wanted to go. But we just got together from multiple oncology nursing chapters in California. And again, too, it was just a select few because not many people were really understanding what advocacy was or what nurses' role was in advocacy. But we had the support of ONS, and they helped us make it happen in terms of supporting us with, advertising through ONS and providing materials. But really, it was the nurses from these California chapters that brought it forward and brought their passion with them to create better health outcomes for California. And we followed the same format where we picked three bills, and those three bills we studied and we met with our representatives and we advocated for those bills. So they were in line with ONS priorities, but on the state level. ONS deals mostly with federal legislation, and we had some really great speakers. And then our second year was this year, 2024, and we're planning for 2025. And as many of you know, I mean, you're all nurses, so you have been part of that hospital potluck where, you plan it, and then the next day everybody is bringing their best dish, and you have this like huge buffet and party. I liken it to that, where there was a few of us that wanted to make this happen, and we all called our friends, and we pulled out whatever resources we had from our organizations, from our oncology nursing chapters, and just people we just knew through our journey in the nursing profession, and we made this happen. And for the first year, we had California politicians, we had nursing association leaders, and we had patient advocates that spoke. And then this year, too, we continued that trend by having politicians as well. Next slide, please. I apologize. I'm going to go a little quickly through all of this just because the first part took so long. But a lot of nurses want to know why. Why do we need to get involved in government? And whether or not you like it, the government is going to get involved with you. And nursing and or healthcare and politics, healthcare and government, they will intermingle at some point. You may have heard these terms or these things that you work with in your daily practice: HIPAA, staffing ratios, Medicare, Medicaid, DHHS. Well, these have all come from either government regulation, from a law that has passed, or are have their roots in the government. And so even something as simple as the payroll, like, things like that, that's regulated by the government in some instances. So nurses, for the most part, don't recognize the connection between health policy and the bedside, but they're very much connected. So food for thought: in 10 or 20 years, think of the laws and regulations that will be in place This is the time where you can really get involved and make an impact in those laws. And you are all subject matter experts as nurses. You don't need to go and get your master's in political science or anything like that. Just the fact that you are nurses and you know your practice and you have built these relationships with patients and those in the healthcare field, you are subject matter experts and you can speak to this as any expert can on Capitol Hill. Next slide, please. You may have heard of this, maybe the nursing process. So in my day, the mnemonic, I guess, we used for it, I don't know if that's the right term, it was ADPI, and that's how I remembered it. But we are equipped to influence policy just because we are so familiar with the nursing process. That is what that's the framework we work out of every day. We assess, we diagnose, we plan, we implement, and we evaluate. So just a quick example of this and how this translates easily to influencing policy is that for example, if you look in your neighborhood, you're seeing increase in motor vehicle accidents or those types of visits into your emergency room. So you're going to assess, and then you find out it's because intersection lacks signage. So that's your diagnosis. So you plan, you speak to your city council and stakeholders in your community to see if there are laws or regulations that can happen to prevent this from happening. And they implement stop signs for stops. And then your evaluation is going to involve, is this making the community safer or not? So, I mean, there's much more to passing laws and policy than that, but we already know the process that it takes to do something like that because that's what we do every day with our patients. Next slide, please. We can also influence legislation by voting, supporting candidates, being knowledgeable on issues, communicating with legislators, and for the super high achievers, which many nurses are, you can run for office. And I put this on here because it is something that is not far out of reach. We don't need permission to do this. I think that's something why I wasn't even aware that this was something we can do before the pandemic is like, I thought, oh my gosh, do we need permission to do this? Or, what, will I get in trouble if I do something like this? But the fact of the matter is we don't need permission. We govern our profession. We are citizens in our communities, in our country, and these are the things that we can do. And so there's so many ways that we can get involved. And the easiest of these things is voting. Next slide, please. So now that we've seen how the nursing profession framework and the things we can do to influence legislation, now that we've seen those things, I want to talk about the why of advocacy. Like, why should we do it? And there are really just 4 items to think about here. We have the trust of the public. As you know, we're one of the most trusted profession. And especially as oncology nurses, we journey with our patients during the most difficult times of their lives. They entrust us with their stories, and it's really a disservice to them to not bring their stories and struggles to light and find solutions so that others don't have to stay in that struggle. Secondly, we have compassion. I think, nurses go into this profession because we want to help other people. We want to make the world a better place. So if you're coming at it from that position, and putting it like on a national policy stage, I envision that nurses would influence policy by making laws and policies more compassionate. We also have the skills based on our training and education. And I mentioned, many nurses have multiple certificates. We can do it. We're far more educated and prepared than many people who are sitting in Congress today. Think about the businessmen that are in Congress. Physicians are in Congress. There's lawyers in Congress, but there's not many nurses. I would say, I think 2 or 3 right now who are in Congress. And you can talk to your senators, you can talk to your legislators as easily as talking to that patient. You walk into the room and you establish instant rapport and introduce yourself and tell them what you're going to do. They trust you. So, you can easily translate that skill to speaking with your legislators. And lastly, we have millions in the workforce. Sadly, there's not the 6.5 million anymore. We're closer to 4.5 million, but that is still 4.5 million people that can really move the dial of healthcare in this country. Next slide, please. Also, too, it's in our professional code of ethics. Some people will say, oh, I don't want to get involved in that. I might get in trouble. But really, our code of ethics covers this. I'm going to go over just a couple provisions in it. I mean, you can read this. I'm going to record, this is recorded, so you can also view this afterwards. But there are things in our code of ethics that really speak to social justice and making sure that we're providing healthcare that's equitable. So as you see there on the slide, if you look at the ANA Code of Ethics, provisions 2, 3, 5, 7, 8, and 9, and you know, that's most of the provisions. They really support nurses getting into advocacy. Last slide, please. Or next slide, please. So just my takeaways. We don't need permission to advocate beyond the bedside. Our code of ethics really compels us to be civically engaged. We either build the future or we live in someone else's, and that's really the truth. And connect with national and local ONS chapter, your local ONS chapters to see what advocacy opportunities there are. In the next slide is a photo from the first Capitol Hill Day that I attended, and we're there with Representative Lauren Underwood from Illinois, and she's one of the few nurses in Congress, and she spoke to us. So you can see how many people were there for that Capitol Hill Day, and I would love to see that increase thousandfold, that many nurses that are civically engaged and wanting to make impacts in their communities at the legislative level. And then our next slide shows how our stories are powerful. So there's some pictures from the 2022 and 2023 Hill Day and Advocacy Summit, and we were a small and powerful number the first year, but I really hope that number grows. And the final or the last slide with the photos show just how we've met to plan these meetings. So we had participation from oncology chapters all over California and met in Sacramento to see our plans come to fruition. And I want to thank you for your time. The additional slides just show the references. And if you'd like to get in touch with me, you can reach me on social media. I'm known as Citizen Nurse, so you can just send me a direct message through there. And thank you for your time tonight.
And now I would like to introduce Celine Palmer, our next speaker. She is a board member of the San Diego ONS chapter, and she is the principal author of our ONS California's poster presentation for the ONS Congress 2024. Take it away, Celine.
Thank you. Fantastic presentation, Jelani. There's going to be a lot of overlap. Advocacy is fantastic and amazing, but there is a lot of the same. So this is just really drilling it down. Good evening. Thank you everyone for joining. My name is Celine Palmer. My pronouns are she, her. I am a member of San Diego ONS, and I'm a nurse at the UC San Diego Moores Cancer Center. Next slide. I have nothing to disclose. Today we are going to talk about, we're going to discuss the role of the nurse and advocacy and how it shapes healthcare. We're also going to talk about the implementation of our state advocacy event made up of California ONS members. And hopefully at the end of this whole webinar, we're going to talk about, or hopefully empower some nurses to become more engaged with their legislators. So the future of healthcare, the future of nursing 2020 to 2030, charting a path to achieve health equity, is an initiative that was led by the National Academy of Medicine, and it focuses particularly on these social determinants of health. Not sure how many people are very familiar with it. I feel like it's kind of one of those things that gets thrown around and we hear about it a lot, especially at meetings or when we're talking about things that we're focusing on to provide better patient care. But this lists out the 5 different aspects of it. And this particular report gives specific ways that nurses can work to achieve health equity on our end. So one part, talks about economic stability. There's other parts that are very, very nuanced, but they all are speaking about the non-medical factors that influence healthcare outcomes. So there's a lot of different things that we can kind of do in this sense. If you're talking to a patient about how they can achieve or how they can get any sort of access to food, if you're helping a patient obtain access to transportation, anything with safe housing, you're helping to contribute to this. And by effectively tackling these factors, It requires a collaboration between healthcare systems, government agencies, as well as community groups. Next slide. The social determinants of health and social needs model of Petrucci and Arbach presented here identifies 3 specific strategies that nurses can use to help improve health equity. So listed here are 3. It's upstream, midstream, and downstream. Upstream strategies improve community conditions through policy. Midstream, it addresses individual social needs. And then downstream provides high quality clinical care. The basis of our presentation today is going to be talking about this upstream, so talking about our effect on policy. This slide lists the ONS Center of Advocacy and Health Policy. So it shows all the different ways that being an ONS member can help you with advocacy. The current goals of the ONS Center is to promote oncology nurses' practice to the full scope of their ability, improve the quality of cancer care, and advocate for payment models that positively impact oncology care. As an organization, ONS works with government agencies as well as us to help forward these goals. As a member, we have access to health policy resources, advocacy classes, webinars, podcasts, and special health policy events such as our ONS Hill Days. This was the famous Hill Days that Jelani was talking about. So the ONS Capitol Hill Days is an education conference where ONS nurses from all around America come together to learn about different advocacy issues. And then they take those issues and that knowledge to meetings with their legislative elected officials, senators, and representatives on Capitol Hill. Pictured here is our California group from the 2022 ONS Hill Days. During that event, we were actually in the cafeteria waiting for our next meeting. We kind of came up with this idea of, hey, wouldn't this be really cool if we can do this, but just on a smaller scale? And just in California, we're so big, we're spread all throughout the state. That would be so amazing. And, honestly, it kind of just snowballed from there. It was just that whomever brought it up and took it, and we just kind of ran with it. So just that little spark of an idea has totally flourished. It's pretty quite amazing. So as we were speaking about expanding our advocacy work, we wanted to talk about this California-based event. I would say that most of us that were present there that day at the Capitol Hill Day event are all part of this planning committee, and we modeled our event after that event. So we spent the first day teaching basic advocacy skills, and then the second day was spent engaging with our lawmakers at our Capitol. Embracing the essence of true grassroots rights advocacy, as Jelani explained, our summit was curated for oncology nurses by oncology nurses. Every aspect of this, planning to marketing through social media, was decided on by our team. It was also completely funded by donations from various California chapters. Since this was our first event, social media played a huge role in spreading the word. Big hats off to Jelani, who's our social media queen. And so we were able to use that and leverage that to kind of spread more information, especially because it was our first time. We hadn't really established ourselves yet. Our planning committee was composed of 15 nurses from 11 different chapters across the state, ranging from San Diego all the way up to Sacramento. We also received some guidance from Alex Stone, the 2023 Director of Government Affairs and Advocacy. Our planning members represented various areas in nursing, including inpatient, outpatient nurses, managers, directors, pharmaceutical nurses. The diversity of our group helped to reach and engage a wide range of nurses, since there was only 3 months from our first meeting to our actual summit in order to get a or basically in order to be very effective, we split up into 5 different subcommittees to share the workload. Listed here were the specific subcommittees. I'll briefly go over them. The speakers, pretty self-explanatory. They focused on finding speakers that would provide insight on importance of nurse advocacy and also how we can make a difference in legislation. Meals and activities, they coordinated all meal programs as well as separate engagement events around the program. Logistics coordinated our venue for day one and hotel details. And the policy team was in charge of choosing 3 pieces of legislation that we would be advocating for the next day. Registration monitored and maintained online and on-site registration. Listed here are the topics that we discussed on our first day. As you can see, we had a pretty wide array of powerful and inspiring speakers, including ANA California, the CEO of Sutter Health. We had some patient advocates, as well as some elected officials. We also included a section at the end to discuss the specific bills that we were going to be advocating for. Next slide. Our second day consisted of individual nurse meetings with their elected officials at the Capitol. I also listed here the 3 bills that we chose to advocate for. The biomarker testing, which ensures that testing is covered by health insurance plans, including Medi-Cal. The Cancer Prevention Act, which is the addition of the HPV vaccine to the current immunization requirements. And then the Ken Maddie California Cancer, oh my gosh, sorry, this is a tongue twister. Ken Maddie California Cancer Act, which helped to improve our California Cancer Registry. We had a very successful event. We had 62 nurses in attendance, which is a huge deal, I think, for our very first year. We were also able to provide 3 CEUs for the summit. Evaluations completed at the end noted a Net Promoter Score, NPS, of 93. The NPS is scored on a scale of 1 to 100, with anything greater than 60 indicating satisfaction. Feedback indicated that some nurses had difficulty scheduling meetings with their legislators. We also missed the opportunity to collect any pre and post knowledge assessment. And then as a planning group, we had previously discussed budgetary limitations for the event. With multiple chapters contributing and paying for expenses, it became a little bit fragmented. So the following year, this year, we created a budgetary subcommittee to help maintain transparency for the money that we collected and then track individual chapter contributions. Super exciting. All 3 of the bills that we advocated for were passed and signed into law late last year, basically a year ago, which was a really huge opportunity and a very exciting thing for all of us. So what's next? We plan to continue with our summit. We did one earlier this year, and we have another one coming up spring of next year. We're adding more nurses to our planning committee to help with succession planning. San Francisco Bay Area ONS also created a specific board position for advocacy. We're hoping that other California chapters will follow suit. We're also continuing to utilize social media to raise awareness and help promote for future events. We have included webinars such as this to help keep momentum alive and up between events. We're also looking forward to partnering with other healthcare organizations to form some coalitions that strengthen and expand our reach. And our ultimate goal really is to help develop and write policy that impacts nursing practice and oncology care. Our second annual summit was held in March of this year. We presented 2 awards to state senators who helped to advance legislation that improved cancer care. We were also able to include members of ANA California, Capital Black Nurse Association, and National Association of Hispanic Nurses. We also got some media coverage, very exciting. We were featured in an Assembly members newsletter, and there was a press release from Senator Portantino from his office, which if you click on that or scan that QR code, you can access and read. So the big takeaways, going back to that original model, engaging in an upstream strategy of advocacy, nurses can promote health equity and patient outcomes. We are already all advocates, whether it's on behalf of a patient, a colleague. Many of the things that we do on an everyday basis are influenced by policy, such as our scope of practice, patient ratios, patient access to medication. Lawmakers are making decisions that directly influence the care that we can provide and how we can provide it. Our advocacy work can affect thousands on a local level and then millions on a national level. And it comes in so many forms. This isn't just meeting with legislators. A simple way to start using your nursing voice is simply by voting. You determine who holds political power, who influences health policy, and how our resources are allocated. We are the most trusted profession. We all have a powerful voice and we all have stories to share. Honestly, I couldn't think of any group that's more suited to advocate than us. I would encourage anyone that's interested in ONS advocacy or advocacy to check out the ONS advocacy page. Contact any one of us here that are on this panel. We've been doing this for a couple of years now, and we would love to be able to see some of you at our event next spring. I also just wanted to give a huge shout out to, this is our planning committee. I am representing all of these people and all of their hard work and dedication to excellent patient care and nurse advocacy. I just wanted to, and then we have some references, but I also wanted just to give a little touch. We have 4 weeks today until our election. So please, please, please make sure that you are using your voice and you are registering to vote. Last day to register in California is October 21st for a mail-in, and you can register the day of if you aren't registered when you come to vote. Thank you.
Perfect. Thank you for that reminder, Celine. So important.
Never too many reminders.
And thank you for providing that roadmap to really forming our state advocacy group. Super exciting to see that all of the bills we advocated for in our first year were passed into law. So now I would like to introduce our panel, made up of nursing leaders throughout the state of California and who are part of our planning committee. So Precious Rivera is the board advisor for Silicon Valley chapter. Tanya Brubaker is the president of the Napa Valley chapter. Suzanne Tay Kelly is the director at large for the San Francisco Bay Area chapter. Jamie Mercado is the program chair for the Greater Sacramento ONS chapter. And Nancy Hirano is the treasurer of the California East Bay chapter. So from all over the state and nursing leaders throughout. I'd like to start with Precious. Give us your take on advocacy.
Hey, everybody, and good evening. My name is Precious, and I'm part of Silicon Valley and Napa Valley ONS. I currently work as a HEMONC case manager at Kaiser, Oakland. So advocacy to me is basically just standing up for whatever is near and dear to you. In this case, it's for our cancer patients. And this California advocacy group has taught me how to strategically present issues that affect our patients. So what I really wanted to say at our the last Cleon's conference to everybody that was at the table, it's kind of a way to organize your daily frustration, sometimes your anger in a certain way to get the attention of our legislators. If you're tired of being short-staffed, guess what you have to do? If you're tired of just by being burned out every day, well, then it's time to get it's time to get fired up about advocacy then. So no more being burned out, and just stand up for what you feel like is right for us and for our patients.
Thank you, Precious. Now I'd like to call on Tanya Brubaker to give us your thoughts. Tanya, are you on mute?
Yes, sorry.
There you
go. Okay, I'm Tanya Brubaker, and I'm the chapter president of the Napa Valley Oncology Nursing Society. And advocacy is very very near and dear to my heart. And knowing that coming to work every day, I work in industry, and making sure patients can receive medications, not paying a lot of medication, that starts out in government. I mean, we have to go forward, and when we get patients what they need, it comes in all forms, and we have to really advocate for them in all different kinds of ways. So, and being the chapter president of Napa Valley Oncology Nursing Society, I feel that every chapter meeting, we bring up advocacy every day just to let the membership know that this is how we get things done. We have to go through government, and it's really important to advocate for our patients and every aspect of their needs.
Thank you, Tanya. Now I'd like to call on Suzanne J. Kelly.
Hi. Thanks all for being here, sticking out for a late evening. Just hearing you all, I think one of the greatest pleasures for me, the whole Hill Days, was just meeting fantastic people who are interested and passionate about advocating for their patients. And this journey, and Jelani's characterized it well, it is a journey because, we all start off like, what has that got to do with me? And just falling in love with the whole process of learning, and the support from national ONS, as well as this little part that we have done. So after the Hill Days and the summit, Celine did this wonderful summarization of what was achieved during the first summit. And so this year we submitted another abstract, just on continuing it, keeping the dream alive, I think we're trying to call this one. And that we wanted to make sure that the whole momentum that we created with this journey would be embedded into our chapters and just members, so that it was just not a little small group that was active in this. And so this next abstract that we have submitted is focusing on what individual chapters have done to keep going. And some have done many different things. Like she was saying, I was president of the San Francisco Bay Area chapter of the ONS. What we did was just create a position so that we have someone now who is dedicated to that as their board position duties, to promote advocacy and also just represent us at these planning meetings and just basically continue advocating for advocacy within our chapter. Other chapters have put advocacy as a board agenda item that is discussed just on a regular basis, and also just to communicate updates on legislative issues that might be relevant to us, to the membership. And there are also groups that, like Precious's group, has done or is planning on doing fundraising for scholarships to fund nurses who would like to go to Capitol Days or to the summit. So that was very exciting, just to show how people are getting interested and want to keep interested. Peace.
Wonderful. Thank you, Suzanne. I'd like to call on Jamie Mercado next.
Hello, everyone. Yes, I am Jamie Mercado. I wanted to thank everybody for joining in, and to my incredible friends here. My advocacy experience was coming in new. I have been volunteering with ONS for a long time. And I really have to give a lot of credit to Alex Stone, because I was the program chair and coordinating our annual education day. And we thought it would be great to have him come out. And so we flew him out, and he is just such a dynamic person. And he really took myself and Carrie Stewart, our chapter president in the Sacramento area, under his wing. And we did a couple meetings. And I realized doing that, the power of sharing your story, and that at any level of nursing, you can get involved. I think sometimes being new at it, especially, myself as a nurse going through the pandemic, I thought, well, who am I really to speak up and say anything? But having the stories that I've witnessed firsthand made a really big impact that day with our legislators. And it inspired me to continue moving forward with this. And it's been a wonderful experience of collaboration, getting a chance to learn from experienced advocates who've been doing this a long time, who have been able to share their wisdom and really take the intimidation factor away from getting in there and getting involved and using your voice, and having that confidence that you are the subject matter expert in the room, and that you can answer those questions and develop those relationships with your legislators, because they're just people too. And I've been able to establish a really wonderful relationship with my legislator through this process, and just continue to encourage anyone to join in, get involved, and speak up, because sharing your story is extremely powerful. It makes a really big difference.
Absolutely. Thank you, Jamie. And Nancy Hirano, last but not least.
Thanks so much, Wendy. And thanks so much again. I'll echo everyone else's comments that we're appreciative of you joining us tonight. So I have been doing nursing advocacy for a long time, and I've been on many visits to the Hill. So when Jamie was talking about intimidation factor, I have to tell you, even though I've done many visits, I'm still nervous when I get in front of a legislator. And I cannot tell you why that is. I speak professionally, but I am. And I have to remember that I like making a difference every day, and I've done it in many ways clinically for patients and nurses, but doing health policy advocacy is a way for us to do it in a different way than that's clinical. And it can make such a big difference. And as Jamie mentioned, and others have mentioned, we are the subject matter experts. We are trusted. And so it's just really gratifying to be able to go up and speak on behalf of our patients. It's an honor. And I just want to mention a couple of things. We've talked a little bit about the event that's coming in 2025. That is on April 28th and 29th. I don't know if, Wendy, you're going to wrap it up and talk about that a little bit, but I just wanted to put that date on your calendars. And advocacy, there's an Advocacy 101. Oh, thanks. That's great. There's an Advocacy 101, Making a Difference, ONS NCPD program that is 2.75 hours, and it's free. I did help to rework that with ONS and some colleagues. And so, but it's a way to, if you're never done advocacy before, it's a way to get your feet wet and understand a little bit more about it. And it's functional because at the end, you'll have a plan that you've been able to develop. And then also the ONS Center for Advocacy and Health Policy. I just want to put a plug for that off of the resources that are on our ons.org website. So it's been an honor to work with these folks and really make that difference. And I've really had a great time. And that's part of it too, isn't it? To just have some fun when you're doing this kind of work. And it's great to do it with such great people. Thanks, Wendy.
I definitely second that. We do have a great time. So like Nancy said, we do have our upcoming event in 2025, our ONS CAS 2025 Advocacy Summit, April 28th and 29th. And it's limited to the first 100 attendees. So please go ahead and register. There's a QR code right here. And it's going to be a great time. It's a great chance to learn and advocate and meet amazing people in Sacramento, California. So please sign up. Please encourage your nurse friends to sign up. Please follow us on Instagram. We are at Cal Advocacy Summit. You can DM us. And thank you everyone again so much for attending this, for learning about this. And we hope that you take this to your chapters and to your nurse colleagues and your nurse friends and let them know that this is here for them. Thank you very much, everyone.